Sugar Talk brought to you by Diabetes Endocrinology Consultants and Dr. KG and Lucas in the house. Good morning, doctor. How are you?
Good morning. I'm fine.
You have a friend with you.
Yes, this is Zadie. She's an anatomically correct. Well, not really. No. She's a doll that you can display her organs. That's
okay.
not. I mean, all the organs, because we're going to talk about kidneys, and nobody knows where their kidneys are.
Yeah, that's right.
So point to you where your kidneys are. Where do you think your kidneys are? You might know.
I think they're back here.
Yeah, they're back in the back. Most people point their low back.
Yeah.
And that's not where they are.
Oh,
because they're protected by the ribs. So we're going to have her turn around and pull down her pants, and then she can show you.
All right.
We can see that. Now, radio people probably can't see that.
On the YouTube feed later.
That's right. They go to the website. Yeah. So we have the ribs and the tailbone here, the ribs and the spine. Sorry, that's not a tailbone.
Right.
It just looks like it. And then if you pull up the ribs, if you display it, then you see two bean-like structures like kidney beans.
Right. Okay.
And they're behind the ribs, so they're in the back of the ribs. So the ribs are about halfway down your spine.
Okay, so it's higher than I thought.
It's protected. They're protected by the ribs, just like the heart and the lungs are protected by the ribs. That's what the ribs are for, is protection. So the kidneys up here, they have tubes going down into the bladder. That's what the bladder is. And so you want to know where your kidneys are, not necessarily for any reason, but I want to show you where they are, because a lot of people think they're low in the pelvis, and that's not where they are. Now, if you have a kidney transplant, they do put them in the pelvis in the front, but they don't put them back in the same place.
They don't put them back where they were.
No, it's easier to access if you go around to the front and do the pelvis.
And just rework the plumbing. Huh?
So in that case, it would be lower frontal. And this is in the back in the middle. So I just wanted to show everybody where their kidneys are, because diabetes affects the kidneys, and we're going to talk about that.
Okay, all right. I think I always heard the term kidney punch and thought that was a lower punch. There you go.
If they're punching you there, that's not the place.
Yeah,
that's not the place they should be.
And so you use that doll to help kids understand what's going on with them.
Yes, because it's about the size of a kid, and you pull it up and show them where different organs are.
Okay, well, that's cool. So what about diabetes and kidneys? What is the relationship?
Well, the kidney, if you think about it, what is the kidney? It's just a bag full of little teeny blood vessels, and it's a filtering system. So as the blood passes through the kidneys hold on to the good stuff and get rid of the bad stuff. And that's what the urine contains, is waste products from the body. It's not supposed to contain anything the body needs. It's not supposed to contain sugar. It's not supposed to contain protein. So when it starts leaking those things out, something's wrong. So when diabetes affects all the blood vessels in your body, especially the little teeny blood vessels, and they can get clogged up with sugar and plaque and not work. And when they don't work, they start leaking protein out.
Yeah, I think when we think of filters, for example, if we were thinking of a coffee filter, we would think of the good stuff as being filtered through it. But in this case, it's the other way around. The waste products are filtered through.
Filtered out. Right. So it's like a reverse coffee pot.
All right. So, but if some proteins or sugars are also coming out, then that's an issue.
Now the kidney holds on to the sugar up to a certain point. And when your blood sugar is really high, usually at least over 180, then the kidney can't hold on to all that sugar. It has specific proteins that grab the sugar and put them back in the blood. So when the sugar reaches a critical mass, like when you have diabetes, it's not able to hold on to all that sugar and releases it. Likewise with proteins, you're not supposed to lose any protein from your body. You're supposed to hold on to it because it's an important building block for your body. So if the kidneys are leaky, which means that the blood vessels have been damaged so that it's not able to hold on to all the protein, it starts leaking out protein. And that's an effect of diabetes causing that. Over time, the protein gets higher and higher. The kidneys get further damaged just by the protein being there where it's not supposed to be. And they can start not functioning well. They can start not filtering the blood as well. And if they don't filter the blood as well, then you can't get rid of all the waste products. And there's a point when they don't work at all, and you'd have to be on the dialysis machine, which is not as good as a kidney.
So does kidney disease then have a clear definition, or is it just a degree of how it's working?
The kidney disease and diabetes, there's two groups of kidney disease. One is just the people that are leaking protein out. So if they have more than 30 milligrams of protein just in a urine stick, then they're leaking too much protein. 30, over 30, you know, if it's 40 or 50, it's not too bad. But if it's 1,000, you know, then that's more significant. Then there's another measure of kidney function called the GFR, glomerular filtration rate, which nobody knows what that is. but the GFR is important because they've defined kidney disease as a certain number. Stage 1, stage 2, stage 3, stage 4. Stage 4 is bad because you have to have dialysis. But normal is over 60. So if you have over 60, you're doing well. A lot of people with diabetes are very good at first when they have diabetes. There might be over 100, but over time, that can deteriorate. And so that's what it's a formula, and includes your age and your creatinine level. Creatinine is a product that you need to get rid of. And if you accumulate creatinine, if it goes higher, then you're not getting rid of it. And that's a way of determining how your kidneys are functioning.
How was all this tested for?
Well, the urine test is easy. You just pee in a cup, and they dip a little stick in there, and they find out if you have any protein in it. The regular urinalysis only detects it if it's over 300, so they have a special one that detects microalbumin, and that doesn't mean miniature albumin. That just means a small amount of albumin, and that's what the test is for. Albumin is a protein. If you have a small amount, if it's over 30, then it's abnormal, and then you need to do something to fix it.
I've heard the phrase sometimes that somebody's throwing off proteins. So that just means that they're getting rid of more than they should.
Yeah, and there's other things that cause protein in the urine. Multiple myeloma. There's different kinds of tumors that cause protein in the urine. So it's not just diabetes. However, diabetes makes you lose albumin, and the liver makes albumin. So it's a protein that your body makes to use. It's not something that needs to be cast off. If you have a tumor, it may be making immunoglobulins, which are different kinds of proteins.
Are these tests almost always, though, related to diabetes, or does somebody with diabetes also test positive for some of these other things, and then other disorders get masked?
No, it's usually just the albumin, because the test is very specific. The microalbumin is very specific just for albumin. Now, if you have protein, like a regular urinalysis, that might pick up a lot of stuff, a lot of different kinds of proteins.
Okay. And welcome back to Sugar Talk with Dr. K. Jean Lucas, brought to you by Diabetes and Endocrinology Consultants. And I believe we have a caller.
Brandon in Newburn's got a question.
Hi, Brandon. How are you?
Hey, I'm doing good. How are you?
All right. What is your doing well? What's your question for the doctor?
Well, I'm 24 and I have diabetes. And I don't really manage it as well as I should have, or I should, I guess. But in my urine, it's very foamy, and I wanted to know what that was. I don't know if it's like extra sugar or if it's protein.
Does that have a relation, in other words?
Yeah, a lot of times it's sugar in the urine. Sometimes it is protein. So it's best, if your sugar's not controlled, it's better to get it controlled and then see if that gets better. Then that would be the sugar part. If it's protein in the urine that causes that, then the sugar has to be controlled more over time, because that's a long-term complication of diabetes.
Oh, okay. Well, I'll get some.
So start checking your blood sugar.
Yeah.
Yeah, I just moved here to North Carolina from Virginia, so I need to get on the ball with all that stuff.
You sure do. Yeah, that's good, John, and good that you're thinking of it, Brandon. And now that's the first step. All right.
Yeah, because I was listening like I think a week ago or last Monday, and you were talking about the feet pain and all that too. And I was like, well, I have that too, so that's not good.
All right. Well, let's get this under control, and let us know how it goes.
All right, thank you.
All right, thanks, Brandon.
And
again, young person, and it needs to get that under control, because
and
there's so much you can do now.
We have a couple of studies for type 1 diabetes using a different medication besides insulin. So he may be interested in that if he wants to call our office.
Okay. Again, you can go online at beachdoctor.com and find out all that information. That's the easiest way to find it all now. beachdoctor.com for diabetes and endocrinology consultants. Okay, we're talking about diabetic kidney disease, and what are some things that people can do? Obviously, as you just mentioned, controlling your sugar.
Also controlling your blood pressure, because blood pressure damages the same blood vessels. Controlling the cholesterol, the same old things we're talking about before, but there are medications that actually help prevent the leakage of protein, and those are called ACE inhibitors and ARBs, and those are blood pressure medicines. So a lot of people with diabetes, if they have high blood pressure, will be on those medications anyway. The most common one is lisinopril. That's the cheapest. Side effects would be a cough or dizziness. As far as the ARBs, Cozar, which is losartan, Diovan, those medications actually help the kidneys not leak. So I think they work by restricting the blood flow slightly so that you don't have as much leakage. And of course, if you don't have as much leakage, then you don't have as much damage because the proteins also damage the kidneys. So there's medications. Also, keeping your diabetes well controlled helps the kidneys heal.
And they can heal?
Yes, I think if you catch it really early, that's why we're checking everybody. Because if you can catch it real early and you can start these medications and get the diabetes under control, a lot of times it gets better.
And if you want to find out more about getting better as well, you can call on the folks at Diabetes and Endocrinology Consultants who bring you Sugar Talk every Monday morning, and go to online at beachdoctor.com. That's beachdoctor.com.